All of you here. I've been a family doctor here in San Francisco for 25 years. And I am here to say that hundreds of thousands of doctors and nurses and pharmacists and other health professionals across this country stand with President Obama, stand with you in our commitment to enacting a comprehensive health care reform plan that will assure that every American finally has access to high-quality, affordable health care. Of us working on the front lines of healthcare know as well as anyone how desperately we need this type of healthcare reform. Those of us working in healthcare see every day that woman rolled into the emergency department with a crippling stroke because she could not afford the blood pressure medications that could have controlled her blood pressure and kept her from getting a stroke in the first place. We see the woman that we are diagnosing with advanced breast cancer who did not have the health insurance coverage that would have paid for a mammogram to diagnose that breast cancer in an early curable stage. We see this day after day. We wonder, how is it we work in a healthcare system that spends twice as much per person as any other country in the world, and yet we stand at the bottom of countries internationally at the health care we are providing and the health of our public? How is that possible? Corporate greed, how is it? How is it? Did we go to medical school? Did we go to nursing school? Did we go to pharmacy school to work in a health system or a wealth system? That's it. So this system does not reflect the values that those of us who went into the health professions, and it is not delivering the goods to the people who need care. So it is time, and the time is now. I've been working on universal health care coverage for 25 years. I see some of my mentors, Quentin Young here from Chicago, have been working on it for twice as long as that, and then some. And you know what? We are tired of waiting. Watching all those town halls that we saw. So it is time to, let's just say, come out of the closet and say, we are San Francisco liberals and proud of it. We say that San Francisco, the values of San Francisco is that healthcare is a right, and that should be an American value. In prevention, and that is something we should do nationally. The values of America is that healthcare dollars should go to pay for the care people need and not just for the profits of large insurance company interests and other people profiting from the system. So that is the diagnosis and that is the treatment. So it is time for us to stand up and say those are the values we want to see. And the other value we have, and we know from what Ken Jacobs says, we have a value, and our value is not only that we want a public option, but many of us would just get it over with and have one public single-payer plan for everybody. Those are the values that we stand for. There is nothing to be embarrassed about it. It's time to stand up and demand change. It starts here on the West Coast, and we drive this change to America. And we say, not only, yes, we can, but yes, we are going to do it, and it's going to happen, and we are going to get the health care reform we need. Thank you very much.